USMLE questions can be long and tricky, and so is learning how to consistently solve them. To do well on an NBME exam, a deep understanding of exam-relevant knowledge is no doubt necessary, but by no means sufficient. You'll also need a very specific set of test-taking skills. Over the next hour, you'll learn the basic principles for decoding exam-style questions. Too long? All right, let's do it in 5 minutes then. This knowledge will help you truly understand these questions and get better at solving them. We'll also see how studying with the AMBOSS Q-Bank trains you to apply this strategy more naturally, be it during your prep phase or in the actual exam. Okay then, to kick things off, let's look at the basic structure of an NBME question. This can be broken down into 4 parts. Here's the first one. Every single question on an NBME exam will present information to you in a fixed and consistent order, every single time. You'll internalize this order anyway as you practice more questions, but if this is news to you, then hit pause now and make a note of this order. Now, of course, not every question will contain all of these elements, but the sequence of information, you can bet it'll stay the same. In an exam like the USMLE, where time management is so incredibly crucial, knowing this order will help you locate the exact information you need and do so faster. That way, you can read, solve, and move on. That brings us to this next point. Is everything in the question important? Well, most questions, especially on Step 2, contain tons of personal and clinical information, just like the patients you'll manage in real life. And sometimes, some of this information, also like in real life, is just not necessary to solve the case. In fact, occasionally, this excessive information might even mislead you and take you away from the answer. As you solve questions, it is crucial to develop a strong radar to intuitively pick out this distracting information and to be able to focus only on the info that'll lead you to the right answer. Now let's look at another crucial part, the lead-in. It is the most important part of the question. Identifying exactly what is being asked of you and doing so fast is the key to knowing which parts of the question deserve your time and focus. The trick is to use the lead-in to quickly figure out what the question is really testing you on. This helps you narrow your focus so you can go on and solve the question without getting distracted. Next, let's move beyond the question itself and go to, drumroll please, the answer options. Most questions you'll face in the exam will have between 5 and 8 options, but a few questions might have way more or fewer. The kicker is that in the exam, multiple of these answer options could be correct. But remember, only one of them will be the most correct answer for the specific conditions mentioned in that question. And this is the one that you're supposed to pick out. So when you're assessing the answer options, remember, don't just pick the first option that looks kinda correct. What you want to do is read all of the options. There just might be one which is a bit more correct. So, you still with me? Nice! So, to wrap it all up, you need to keep these 4 basics in mind. Remember the fixed sequence of presenting information in a question. Develop a radar for picking out the distracting information. Read the lead-in first to know what to look for. And don't choose the first option that looks kinda correct. If you remember these, you're well on your way to becoming a pro question solver. Sounds good? What's better, the AMBOSS Q-Bank is designed to train you in these basics so that the more you use it, the stronger you become at solving questions. Let's see how. To start with, it helps you narrow your focus when reading through a question. As you already know, USMLE questions tend to contain a lot of information. And remember, you have on average just 90 seconds to solve a question in the exam, which is clearly not enough to read through every single word. The AMBOSS Key Info feature highlights the information crucial to solving the question. This way, it trains you to see through the noise and focus on what's really important. Over time, the more you practice with AMBOSS questions, the more intuitively you will focus on the most important bits. And so, become a much more efficient question solver, even in exam conditions. What else? It'll train you to think your way through questions. So let's say you figured out what's important in the case, but you're still a bit lost. With AMBOSS, you don't have to resort to guessing. Instead, the attending tip gives you a little hint, which nudges you to think in the right direction. And in case you end up choosing the wrong option, no worries. Unlike the Q-Banks that we studied with, the AMBOSS Q-Bank won't just give you the right answer. Instead, it gives you another chance to squeeze more learning out of that question. Each of AMBOSS's incorrect options comes with a specific explanation that helps you course correct and teaches you a connected concept so that you learn from your mistakes and get more out of every single practice question. With time, this practice trains you to think more like a real clinician and decode a case, so that in the actual exam, you can get to the right answer without getting lost along the way. The secret to performing well on exams is not how many topics you know, but instead, what matters is how well you know the most high-yield topics. When you're solving questions in the AMBOSS QBank and need to dive deeper into a topic, you don't have to spend time looking for another resource. Simply click on the links in the QBank to get a high-yield article with all the exam-relevant information you need. Or simply use the search bar and get to an excellent learning and clinical reference in seconds. Think of it as your own medical Google. With over 5,000 exam-style questions, a guided question-solving experience, and additional tools that save you from switching between different resources, you'll be ready to face every exam with AMBOSS. AMBOSS, more than just a question bank.